Hello, I'm Dr. Yvonne Hanley, a member of the visiting faculty at the Pankey Institute. Superior verbal skills have always been critical to practice success, but they are even more important in today's highly competitive marketplace. Knowing the ideal way to speak with patients, especially new patients, is crucial for providing an outstanding patient experience and achieving high case acceptance. Using this system to recognize each person's prevalent social styles, we are able to quickly and efficiently communicate with folks that we may have just met. This is meant to be a follow-up to the social styles video I made 15 years ago, as you will be able to tell from the quality of the video. Yep, same person, same patients. I've changed, but my patients haven't. Hope you've enjoyed applying what you learned in the first video in your offices. I recommend reviewing the first video before you do the exercises that follow. As you watch this, be thinking about how to best communicate recommended treatment to each of these individuals. Hello, I'm Dr. Yvonne Hanley. I'm a practicing dentist and a member of the visiting faculty at the LD Pankey Institute. In this video, I want to expand on what you already know about the social styles profile. We will specifically address how you can use this in your office as part of the preclinical interview by coming into my office and meeting 4 of my patients. My goal is to show you how use of this system can greatly improve your effectiveness in meeting your patients' wants and needs. Dr. Pankey, in his Cross of Dentistry, identified 4 areas that as dentists we need to be proficient in. Know yourself, your patient, your work, and apply your knowledge. By studying and applying what we know about social styles, we are aided in 2 arms of this cross. Know yourself and know your patient. Dr. Pankey talked about understanding our patient's temperament, circumstances, and objectives, and thereby more appropriately addressing their wants and needs. To quote Stephen Covey from 7 Habits of Highly Effective People, "Seek first to understand, then to be understood." To build the kind of relationship-based practice that will thrive in the new century, one must remember the advice of Bob Barkley from the 70s. He said the health of the relationship is always more important than the health of the patient. Becoming adept at using the social style identification system and implementing its use in our practices is an important aid in achieving our goals. There are many different models and tests describing personality types. This one lends itself particularly well to dentistry because all we need to do is observe a patient's behavior. Based on what we see and hear, we can effectively flex our own systems and behavior to better communicate with our patients. We don't need to get into a deep psychological analysis to key into what we can easily observe in their behavior and quickly make them feel more at ease. Human nature is such that we all naturally and intuitively take in this information and react to it. But by implementing a system and giving a certain set of characteristics a name, we can better and more consistently serve our patients appropriately and efficiently. This system enables the entire dental team to communicate a large amount of information regarding a patient in a very condensed fashion. For example, at the morning huddle, I could explain to my hygienist Lori how Mr. Johnson, who is in her schedule to begin Phase 1 perio treatment, will be interested in the scientific data regarding the research on root planing therapy. He will also want to know the specifics of the bacterial component and the host response, etc., etc. Or I could simply say, "Now remember, Lori, Mr. Johnson is an analytic." But I get ahead of myself. Before you meet my patients, let me share with you some helpful hints in identifying style. As you know, there are 4 separate social styles in this system. Instead of thinking of this as 4 choices, it is easier to break it down into 2 scales, responsiveness and assertiveness. First, let's look at the assertiveness scale, the horizontal component. This refers to the way a person is perceived as attempting to influence the thoughts and actions of others. To measure the degree of assertiveness, Think of it as ask assertive or tell assertive. On the right side is the person that tends to use declarative statements, speaks in a firm, quick manner while leaning into their listener. In contrast, an ask assertive person will speak more non-intrusively, lean back, be more deliberate, and use many conditional statements like, "Don't you think?" The vertical scale is responsiveness. This is the way in which a person is perceived as expressing feelings when relating to others. People will either be controlled or emote responsive. Or you can think of this scale as being task-oriented or people-oriented. A person on the emote or people-oriented lower part of the scale will talk about relationships. They'll easily expose their personal feelings and speak with varied gestures, facial expressions, and voice pitch. A more task-oriented or control-responsive person will use minimal body gestures, appear more reserved, and will talk about facts and tasks versus feelings. Once an educated guess has been made on these two dimensions, the scales can be overlaid, the observed behavior can be plotted, and a probable social style will be apparent. A few points to remember. We are not naming or classifying our patients. They walk in that way. We are merely identifying their behavior pattern, just as we identify a myriad of characteristics about their teeth in the intraoral examination. Also, it needs to be said that all people are equal. There is not one style that is better than another. They are simply different. There is approximately 20% of the population that doesn't exhibit a dominant social style. These people are either very skilled at versatility with interpersonal relationships, or they are so near the center of the scales that there's no one dominant behavior. So you're saying, sometimes I'm this way and sometimes I'm another way. Well, yes, that's true. We are all four-style people. No one person perfectly conforms to one type. On the other hand, most people do have one style that is used most frequently, one that requires the least amount of stress for a person. Also, the most difficult person to apply this to is ourselves. And the next most difficult is those that we are very close to and we know well. However, with our dental patients, when we are getting to know them, this is quite straightforward and easy to use. By using this with our patients, we can use our own skills at versatility and flexing to individualize our systems and style to best address their concerns. With that in mind, let's go to the office. Almost all new patient encounters begin with the patient calling the office for an appointment.
Doctors Hanley and Murphy, this is Sonia.
As the necessary information is being exchanged, the receptionist is also tuned into the patient's style. How fast are they speaking? Are they to the point and rushed, or do they want to chat? Are they talking about feelings or facts? Based on this conversation, she will have an initial impression regarding this person's probable social style, and she will note this in the lower right corner of the phone slip. At the morning huddle on the day of this person's appointment, she will share with the entire staff the pertinent information regarding this patient. As part of this briefing, she will include her initial style analysis. In this way, we can already be more prepared for appropriate treatment for this potential patient, even before they are in the office. For instance, if we think this person is a driver based on the first phone call, I will be more likely to move along with the preclinical in a more direct, faster pace, and the dental assistant will know the preclinical could last only 5 minutes versus 30 minutes with an amiable. Okay, let's go visit with 4 of our patients. You checked on your registration form. You're slightly apprehensive when going to the dentist. When
Yes.
you think about visiting the dentist, what's the worst part of it for you?
Pain. Hurts. It hurts. I've had very sensitive teeth, and so even cleaning my teeth can be painful. Okay. And although that's gotten better, that still is something that I think about before I come.
Okay, all right. Well, we will do all we can to make that easier for you. What other things are important to you as far as your dental office?
I think it's important to me that the office appears to be efficient and well run, By that I mean that I get in pretty promptly when my appointment is, even though I tend to be 5 minutes late for everything. But that I kind of know the length of time that it will take for appointments and that kind of thing. So I think that's important. Reminders are important for me, and especially appointments are set up, quite a ways ahead of time. I think it's also important to have confidence and trust in your dentist that there is some personal concern about the patient, and that there is some looking at what is really best for you as an individual.
Okay, now based solely on the 2 minutes of preclinical interview, what do we know about Laurel? First, let's look at the assertiveness scale. She answered the questions directly and efficiently, using complete sentences, and even one-word replies. She had direct eye contact and was quite emphatic in her expectations. This behavior would place her on the right side or tail-directed side of the assertiveness scale. Next, let's look at the vertical responsiveness scale. Here we look at how open or controlled Laurel tended to be with emotions and personal feelings. We can see she was very controlled with her emotions, had minimal gestures. Even when at the end she stated that she expected the office to have a personal touch, this was stated as a fact, with very limited emotion. Based on these observations, we can place Laurel on the control or task-oriented end of the scale. Now, overlapping the two axes, we see Laurel is in the upper right or driver quadrant. Further observation confirms this. Even her no-nonsense style of dress, her concern about the importance of time and appointment reminders, and her lack of emotion regarding her teeth or loss of teeth. Isn't this fun? Okay, now as you watch the interview with Deb, contrast it with Laurel and think of the two scales, responsiveness and assertiveness.
Thanks. How may I help you?
Well, we are looking for dental care for our family. My husband and I have recently moved to the community. He's purchased an insurance agency, and we have 3 daughters, and we are looking for good dental care for each of us in our family.
Great. What ages are your daughters?
Well, they are 12, 9, and 6.
Wow. You have your hands full.
Oh, it's a fun family, though. We enjoy them a lot.
That's neat. Are you home full-time with them?
Yes, I am. Yes, I am.
Great.
So, and the fact that you're a female dentist entered into our factor in looking at you as a dentist, because it'd be fun for them, I think, to see that as a role model, too.
As far as your own dental health and concerns you have?
Not great concerns, no.
Okay.
No.
Okay.
Mm-mm. I think it really is important to us to have someone that we can trust, who has high integrity, and who also we would know would be keeping up on things in the dental field, so we felt like we had really good progressive care. So that's important to us. And somebody that our family's comfortable with. And we appreciate that, a place where we can come and feel kind
like
of part of the family.
There, do you have it figured out? Where is Deb on the horizontal assertiveness scale? I think we can comfortably say she is to the left or ask assertiveness side. She spoke softly. She was non-confrontational. She was not emphatic when expressing opinions. In fact, she worded many of her responses in the plural, such as, "we think." On to the responsiveness scale. Did you notice how far forward Deb leaned, showing through her nonverbals how she wanted to make a personal connection? She appeared very friendly and expressed her feelings openly with lots of voice inflections. She repeatedly expressed her concerns about the human aspect. She is definitely family-oriented. So, to the left on the assertiveness scale and to the lower side of the responsiveness scale puts Deb in the category of amiable. We know she will want to feel her family is part of our office family. It will be particularly important to Deb that we make any treatment recommendations in a non-confrontational, relaxed manner, not expecting any fast decisions. We know she sees herself as an extension of the family whole and will need to consult with others prior to making a decision. Now I'd like you to meet Galen. This gentleman has been up all night plowing snow, but still rushed home to shower and shave before his 9 a.m. appointment.
How may I help you?
just new to the area, looking for a new dentist, and my old dentist retired and moved to town, so just looking for a new dentist.
Great, great. How may I help you?
Haven't had my teeth checked for a couple of years, so was just looking for a dentist to do that and clean my teeth, and I have a couple of sensitive ones that I'd like to have checked.
Where do you see yourself dentally 5, 10, 15 years from now?
Oh, I see myself as hopefully having all my teeth and not having false teeth. Hopefully I can keep them, and with preventive maintenance and things like that, I can keep them.
Great. When you think about having false teeth, what would the worst part of that be for you?
Losing them someplace, either that or
Losing the false teeth.
losing the false teeth, or biting into something and then you get false teeth. But maybe that's exaggerating a little bit. I don't know, but I think that would be the worst. But as far as anything else, wouldn't be that bad. Or the hassle that you're going through with them. You know,
Yeah.
got to wash them at night and all that stuff. They aren't with you all the time.
Right.
Are we dealing with an expressive or what? Let's take a look. First, assertiveness. Galen tended to exude energy. He spoke quite rapidly and gestured vigorously. He made decisions quickly and answered questions directly. Galen was definitely more people-oriented than task-oriented. Did you notice when he talked about wearing dentures, he didn't even mention comfort or ability to chew properly? Rather, the first thing that came to mind for him was losing them and the hassle of taking care of them. He would hate to be seen by others with no teeth. He expressed his feelings openly and had lots of facial expressions. In addressing treatment with an expressive, we would want to emphasize how it would be individualized, especially for them, and how the best materials, techniques, and aesthetics will be used. Also, it will be important to stress that at no time during treatment would they be without teeth. We'd want to show them the beauty of even the provisionals. Okay, on to our fourth and final preclinical visit, Mr. Brochat.
Well, welcome to my office, Mr. Brochat.
Okay,
You're looking for a new dentist, is that right?
yes. Yes, our old dentist retired, and he recommended you people here, so that's why I'm here.
Great, great. How may I help you now? Do you have any chief concerns at this point?
Well, I got a problem with two molars a little too far apart back there, and I keep getting food between them. Meat, celery's bad, and it seems like I'm always poking toothpicks in there to keep them clean.
What's important to you as far as when you're looking for a new dentist?
Somebody I can have confidence in, somebody that does good work, good workmanship. Confidence, just like any provider.
And you're retired from the power company? Is that
Ottertail
right?
Power Company,
Okay.
yes. I was an electrical engineer. I was manager of a high voltage transmission, which means I built these and designed these big electric power lines running across the country. There's one between here and Wapton. Have you ever noticed that one?
Yeah.
Big H-frame. Yeah, that's one of my projects, and it was a good job. I enjoyed it, and the nice thing is I left some monuments behind. All those 1,000 miles of high voltage lines I built are still there
Through the cornfields.
through the cornfields.
Oh, that's neat.
Are you getting good at this? So, do you have Mr. Brochat as an analytic? On the assertiveness scale, we can note the lack of eye contact and how he spoke softly and slowly. He had very limited gestures and sat with his back firmly on the back of the chair. This would place Mr. Brochat on the left side of the assertiveness scale. When we look at the behavioral characteristics on the responsiveness scale, we note his formal dress, how he's very fact-oriented and reserved with his feelings. He expressed pride in his accomplishments as an engineer. Less assertive and less responsive places Mr. Brochat as an analytic. When discussing what is important to him in his dentist, he used the words workmanship and provider. Not too personal, please. We obviously want to be factual and detailed, yet to the point when discussing treatment with an analytic. He would be very interested in the specifics of materials and techniques used in his treatment.
I hope this video will help you use the social styles system routinely in your office. I urge you to take the time to develop an action plan and workshop this with your team. This lends itself well to role-playing in staff meetings. One of the exciting and challenging aspects of dentistry is the ability to adapt to patients' individual personalities and to treat people as they are, not as we wish them to be. Most importantly, have fun with this. You don't need a PhD in psychology to learn to use it. This is an easy, straightforward way for all of us to improve our case presentations. Patients lack the expertise to fully judge the necessity and quality of our recommended treatment. Instead, they evaluate our practices on the overall experience inside our office, how well we all communicate with them, and most importantly, how we make them feel. In this video, you will have the opportunity to script appropriate treatment presentations based on the patient's social style. The scenario is, we have gone through the initial patient conversation, we've completed a comprehensive exam, and are now presenting a specific recommended treatment in a way that is appropriate for each social style, which at this point we have identified as our best guess, which is good enough. As a guide to help you go through the assignments, there are Word documents available for you to download on the Pankey website. You may want to print these out before proceeding. The documents list words that are meant to be particularly impactful for each specific style. Is this an oversimplification? Yeah, maybe it is. But we attempt to hit on key motivational words first, get their attention. We can follow with the details later at a time and pace comfortable and appropriate for each patient. For the first exercise, we are going to be faced with explaining to our individual patients why we are recommending a full coverage crown for a molar, even though they experience no symptoms at the time. Okay, let's start with our driver, Laurel. Here's the words that will resonate for a driver. Save time, save money, plan, value, predictable, long-lasting, an investment, cost versus benefit. Negative motivators for a driver would be unexpected, patch, halfway, waste, surprise, uncontrolled, accident. Now pause your player and script what you want to say to Laurel, our driver. How did you do? It isn't that hard, really. Here's an example. Laurel, in reviewing the findings from your comprehensive exam, there is a molar that, even though you're not having any symptoms now, there are prominent cracks radiating out from a very large old filling. This tooth is at risk for breakage. It would be best to restore this tooth with a crown so you can avoid unexpected surprises and possibly have it break at a bad time. By doing it now, you can plan the best time for you. Now, let's use the same example of a crown and go diagonally across to the amiable. Here's adjectives that will positively impact an amiable. Natural, comfortable, longevity, predictability, family, better, new, improved, proper. Negative motivators for an amiable, pain, loss, risky, old, unattractive. Now pause your player and role play talking to our amiable, Debbie, about the need for a crown. Welcome back. Debbie, I understand that your tooth is not hurting now, which is good. However, it's very possible it could start to bother you and break if not taken care of properly. Sometimes a tooth will break in a way that it cannot be restored and result in loss of the tooth. A crown will feel and look natural and last you a long time. This is something I would recommend for my own sister. How do you feel about that? Now, you really need to give an amiable time to formulate questions, and you need to understand that they likely will not make a decision on the spot. It is important to give them the time and resources necessary to make a decision that they won't regret. For the sake of time, we will change the scenario for analytics and expressives. Let's challenge ourselves and select equilibration as our recommended treatment, and we will start with Myron, our analytic. Here are positive words for an analytic. precise, predictable, researched, correct, balanced, comfortable. Some negative motivators would be unhealthy, unexpected, unknown, unpredictable, worry, loss. If you are uncomfortable with equilibration, you can substitute bite splint therapy because the language is very similar. Okay, hit pause and get to work. Okay, how do you feel about what you did? I know this one is tougher. Therefore, it is even more important to spend some time working on a script. Now, by design, my explanation is going to be longer and more detailed to an analytic, even longer than what follows, including letting him hold the articulator with the mounted models to see and feel how the teeth move across each other. Mr. Broshot, I'm concerned with how your teeth are hitting each other as you move your jaws from side to side. There are excessive forces on the molars, which is causing mobility and wear. This may be why you have started to catch food in the upper right, something that you mentioned earlier. Over time, this could lead to pain in your teeth, jaws, or muscles, and even breakage or loss of teeth. I'm recommending for you a procedure we call equilibration, or bite balancing. Through precise, planned, and conservative reshaping of the tops of your teeth, we can distribute the forces on each tooth to be balanced and stable. The goal is to develop a bite for you that is comfortable and healthy over a long period of time. In Mr. Broshot's case, I would probably liken this to the planning that he did to ensure long-term success and service of a power line he was referring to in his initial interview. Due to precise planning and a research-tested procedure, it led to a power line that now, many decades later, is still in service, the same thing we want for his teeth. We have done a comprehensive exam, uncovered the risks, done a trial equilibration on his models, very possibly with him watching the process, and have determined very predictable results. Okay, one more, Galen, the expressive. Now I think that we saved the toughest one for last. Why would an expressive be concerned about a solid, balanced bite? Well, remember, in the initial conversation, Galen did say he didn't want to have dentures. There's your clue. Here are some motivating words for an expressive. Personalized, best, unique, customized for you, enhanced image, new, finest. And the negatives? Non-individualized, average, cheap, standard, not important, loss, unattractive. One more time, hit the pause and work on your case presentation for Galen. All right, are you feeling more comfortable with this by now? I hope so. Here's an example of how I may approach an expressive needing equilibration. Galen, after studying the information gathered at your comprehensive exam, I found many positive aspects to your oral health. Your gums are healthy and your teeth have good bony support. There are no abscesses and your oral cancer exam was clear. One area that is a red flag for me as I study your bite is how when you move your jaw from side to side, your molars drag across each other in a way that places excessive and uneven forces on your teeth, muscles, and jaw joints. You can see here on the models we made of your teeth, there's pretty heavy wear on the back molars. Over time, this could cause serious problems. I'm recommending for you a bite adjustment that we call equilibration. As the word implies, this is to equalize and balance the forces on your teeth. Equilibration gives you the best feeling bite you could ever dream of. This will not only prevent further wearing down of your teeth, which makes them look old, it actually reestablishes the contours that the teeth had years before the wear, thus making them look younger. You deserve the best dentistry, and this is the best for you. I would encourage you as a team to script examples of appropriate language for all 4 social styles when presenting any number of recommendations to your patients. Examples to spend some time on would be FACEBO, diagnostic study casts, x-rays, phase 1 periodontal treatment or scaling and root planing, and regular recare follow-up appointments. You will find you are all doing this to some extent already. By working as a team, you can learn from each other phrases that are particularly effective. There is no true script to be memorized for each situation, but by spending time on these exercises, you will find that Without even thinking about it, you will be customizing your conversations with patients even more than in the past. Years ago, I started writing a letter to each patient after their comprehensive examination, essentially a review of findings. When I was first doing this, I fully expected it to evolve into being able to cut and paste paragraphs for each individual patient's social styles, depending on the diagnosis and recommended treatment being presented. I've found that this is not the case. Each person and their circumstances, temperament, and objectives are different and cannot be neatly fit into simply 4 categories. That said, as I'm writing the letter, I'm definitely cognizant of each person's social style, along with everything else that makes them unique. My hope for you is that you invest the time and energy in these exercises. I know it will not only improve your case acceptance, but also it will save you time. Your team will be better able to appropriately communicate with and care for each person who puts their trust in you as their dental home. Thank you.